welcome to all of you on behalf of the Spina Bifida Foundation and the International Federation with whom I'm associated. It's very nice to see all of you on this working day, and I understand we have a mix of parents, doctors from various specialities, from Bombay, from outside Bombay, families, the press, some senior bureaucrats from the state government who have helped the cause. So it's a mixed gathering and an extremely warm welcome to all of you. I think it's very important. We've all gathered here on a great momentous occasion. And it's really very important because what we are embarking upon is a campaign which addresses one of the topmost public health priorities in this part of the world, not just in India but also Southeast Asia. And why is birth defects and its prevention and awareness such a big thing today in India? It's because if you look at the development goals that the United Nations and the WHO set up and defined for all of us, they set up some targets that we all were expected to achieve by 2015. One of the important goals was reduction in childhood mortality. And unfortunately, the target set for us, for India, was 42 per thousand. We have only been able to bring it down from above 100 to 70, which is not a mean achievement, but we have still not reached the target of 42. And the reason for this is that although we have made a lot of progress in immunization, controlling infections in the newborn, and a certain degree of improvement in primary health services, we still have not addressed the issue of birth defects. Birth defects, therefore, has assumed a much greater importance in the control of childhood mortality. So that's why birth defects is becoming a very major public health issue. Also, the sheer number of cases that a country like India has of children with genetic disorders and birth defects. We have the dubious distinction of leading the world in the numbers of cases with these problems. And the WHO also is taking note and recognizing that birth defects control is a very major issue for India and Southeast Asia. And this was a meeting which was recently held where representatives from all Southeast Asian countries attended and deliberated for 2 full days on how the problem of birth defects could be addressed. I was fortunate to be invited as an expert on neural tube defects. And the WHO also has realized that achieving this is not easy. And in fact, they have said that the WHO and state governments must collaborate with NGOs and campaigns such as gofolic for taking the cause of taking this cause ahead. And they have set up, as far as neural tube defects is concerned, they have set up a very ambitious target. They have said that the target is to reduce them by 35% in 2017, which is just about 2 years. So I think there's a lot of importance being given to birth defects. But are we doing all this just because UN is telling us and setting some targets? Probably not. Because birth defects by themselves are a huge social and economic burden on any society. And of course we know that children born with some of these incapacitating birth defects have a very poor quality of life. They can have lifelong impairment. Some can be subject to social stigma, discrimination, and of course the economic burden, especially in a poor or mid-resource country like India, and where the health system is tottering. It's very difficult to bring up a child and make a productive individual out of a child who is born with a birth defect. So I think the cost and the social impact of birth defect also compels us to undertake a campaign like gofolic. Here are some cost-benefit ratios, and if you see the cost required to prevent one birth defect in, say, the United States is, if it's one, then you spend about more than $40. So it's 40 times the cost required than preventing a birth defect. And so on in every country. In India, if you spend 1 rupee for preventing a birth defect, you would in effect save 40 to 50 rupees that would otherwise be spent in rehabilitating a child with a serious birth defect. So I think the cost benefit is enormous. Here is a list of some birth defects of prominence in India. And on top of the list, you see spina bifida. Then, of course, you have a whole number of congenital heart defects. Then talipes, which is an orthopedic foot deformity. And we have some orthopedic surgeons and physiotherapists with us today. And cleft lip and palate. We all know of the cleft lip and palate, and that is also preventable by folic acid. So which is not much recognized. We all talk of neural tube defect and folic acid, but cleft lip palate is another major problem that can be reduced by folic acid. If you compare India with other countries in Southeast Asia, then this is where India stands. And if you see the birth defect incidence in all these countries is much higher than some of these. And you see Thailand is quite low, but you see India, Bhutan, Bangladesh. And these incidences are alarming. I mean, if you take an incidence of 4.7 here, you're looking at maybe 40,000, 50,000 children who can be prevented. So it's a large number of cases. Neural tube defects, this is the global prevalence. You see the countries in red having the maximum incidence. This slide talks about the distribution in various states of India. And this is good authentic data coming from WHO. So it's, and if you probably cannot read all these names, but Maharashtra actually is not so bad. 2.5 per thousand. These figures 25 are for 10,000, but it would work out to 2.5, and which is above the acceptable 1 per thousand. But look at these, look at Haryana. It's 18 per thousand, which is enormous. So see these other states, 11, 9, and 6. So these are huge figures. And considering this data, you're probably looking at not 40, 50,000, but even more babies born with neural tube defects. So therefore, friends, in India, this is a problem of epidemic proportions. And we need to look at it as an epidemic and that kind of urgency. I always like to compare neural tube defects with polio, because polio everybody knows. Neural tube defects, very few people know. And if you see, if you talk of four new cases of polio, it's frontline news. And we are here today to prevent thousands of cases of neural tube defects. And yet, it's never frontline news. I mean, so we urge, and so it's a good thing to compare it with polio, because then you realize the gravity of the situation. So if one new case of polio is identified, the government machinery gets into action. But here are thousands of neural tube defects which can be prevented by a simple intervention. And therefore, gofolic is a campaign which will address nutritional factors which are a major cause for causing birth defects. Some of the other factors, such as maternal infections, other maternal conditions like diabetes, behavior factors such as alcohol in the mother. So these are something which to a large degree have been addressed. People are aware, but we still don't know what's good to eat for the mother to be. Folic acid, we have been talking about it, I need not highlight. And only thing again and again, we keep saying, that it's essential to take it before conception. So I'm not going to talk too much about it because many people here are aware, but still it's a message. Every day, every OPD, every week, I see a parent who has had a child of spina bifida from the most affluent to the most poor, and nobody is aware that they were supposed to take folic acid, even now. And why do we not get folic acid in enough quantity from food? Why do we have to make pills and advise supplementation? Because for the amount of folic acid that you will require to prevent birth defects, and that's 400 microgram, you will have to eat something like 17.5 cups of orange juice every day to get that level, or maybe 4 slices of liver. So that's impossible, and therefore supplementation and fortification. So the Go Folic Acid campaign has enormous potential. If we all support it, if we all take it ahead, if we all spend our time, spend our money and do effort, because it has the potential to prevent, on a conservative estimate, 25,000 children born with paralysis every year. It has the potential to prevent many cases of cleft lip palate. It has, of course, it will contribute towards reduction of childhood mortality, and of course, put us in line for achieving the target set by the WHO. Quickly, a word about how this Go Folic campaign was born. And one thing I can assure you, this campaign is born without any birth defect. It's a perfectly well conceived. The partners in the campaign are all healthy, and so the Go Folic campaign doesn't have any birth defect. The UK Shine organization, and this is one person I would like to acknowledge, Jackie Bland, is one of my co-directors in the International Federation, and she connected me with this very, very impressive gentleman, Mr. Kartar Singh Lalwani of Meyer Organics. And when I first met him and discussed this issue with him, I mean, he has been supporting the cause of spina bifida in UK, where the incidence is around 1.5, 1.7. And when I told him India has an incidence of maybe in some states 18, he said, well, you know, we have to get together and we have to do something back home. So this is how this Go Folic campaign came about. And then after this initial conception, as I would say, there were many people, many parents who reared this child up. And in those set of parents, we have Mr. Rohit Shelatkar, who's the link between UK and India. And he has been very enthusiastic, very supportive. And of course, Mrs. Uma Kalekar, their India chief, and parents of the Spina Bifida Foundation. The backbone of our foundation is the parents, the kids who have been with the foundation for the last 15 years. And I have seen them as children who are born with this defect. And you just saw, they are now in college. Suman is working as a journalist. And there are others who are now having their own children. So we've come a long way. We could not have done that without the support of these parents. And of course, I would like to acknowledge the support of doctors who have been solidly behind the foundation. I wish to acknowledge Dr. Alaric, Dr. Snehal, who are with us, Dr. Taral. I don't see him around, but he's always there. Shaina NC needs no introduction. Maybe she was going to come, she might soon. Well, she has been a supporter since the beginning. Then I must not forget to mention Leelavati Hospital, which has stood solidly behind me for any activities of the foundation, and the Ashapura Foundation, Jolly Gymkhana. And lastly, we would also like to acknowledge the presence of Mr. Jayant Banthia. Some of those who may not know him, he was the ex-chief secretary of the state of Maharashtra. Before that assignment, he was the health secretary. And at that time, I first met him and spoke to him about prevention of spina bifida. He immediately caught on, was very excited, and then we set about a campaign which we thought we could start in some districts. The next month, as soon as he decided to take this up, he was promoted to become chief secretary. But his interest he kept alive, and we will soon do a few major campaigns which will now come under the GoFolic brand in major districts in Maharashtra. And I cannot end without saying that one of the unstinted supporters of the foundation and of the cause of folic acid, since many years actually, has been Ravina Tandonji, who I think can be very safely given the honorable title of being the folic acid ambassador of India. So I think we should give a small round of applause for this, for conferring this title, which I hope she will gladly accept. Lastly, Spina Bifida Foundation and GoFolic cannot be only about prevention, because we have children, and many of them in this country, who are born with birth defects. So it also needs to be about treatment, about care, and about rehabilitation. And rehabilitation is not just medical part. It involves schooling, it involves occupational therapy, it involves pursuing their cause when they go to work. It involves making swimming champions out of these, and for which the Spina Bifida Foundation, the parents, all work hand in hand. And what the GoFolic also needs to do is not just limit itself to cities. We need to reach out to people like this girl and this boy. We met her in Kutch when we had gone there some years back, and in a free counseling camp. And this was a 15-year-old girl born with spina bifida, who actually should have been walking and should have been in school. But here she was sitting outside where our camp was going on because she couldn't walk, she was crawling, and she had. We welcome Shaina ji with us today. She had promised that she will make it. I'm very happy and very warm welcome to you. So what I was saying is that it's not enough, connect with few patients and families in cities, but we need to reach out and find out. And this was another patient, another boy, not very far away, 16, 17 years old, born with spina bifida, living in New Bombay, and yet never went to school, incontinent, nobody cared for him. Actually, the parents got divorced because he had this disability. The foundation is now actively trying to rehabilitate him and get him back on his feet and back into school. This is a list of activities that we propose to do: urban, rural, lecture series, photo exhibitions, street plays, multimedia campaigns, liaising with governments, awareness in schools, and of course we hope that over the next 5-6 months, 1 year, we are able to establish a unit of GoFolic in every state of this country. So with that, I end my talk. Thank you very much, and I solicit and seek the support of all those who are here and many more who want to support us in this campaign. One very good thing is that now this campaign is a joint activity with Meyer Organics. So we are more sort of emboldened, and we have the resources and the support of what they have already done in other parts of the world. So this will now become much more effective than what we have been able to do in the years in the past. Thank you.
Thank you, sir, for your inspiring words. We now hand over the stage to Mrs. Janvi Modi, who is an entertaining cultural program with very special and talented children lined up for you. Mrs. Janvi Modi is a founder and a very enthusiastic and active member of the Spina Bifida Foundation. Now we have a traditional dance performance put together by someone very special. They are the mothers of a Spina Bifida children who form the core of the Spina Bifida support group. Can I have the curtains closed, please?